Calling all breastfeeding and pumping moms. If you're looking for a delicious way to support your milk supply, you have to try Taste Cherie organic lactation cookie mixes. Created by a fellow mom and physician, these mixes are packed with powerhouse ingredients like organic oats, brewer's yeast, and flaxseed, natural galactagogues to help boost milk production. They're organic, vegan-friendly, and shelf-stable, so you can bake them fresh anytime. Plus, they taste amazing. My kids love them too. Check out Taste Cherie on Instagram or at tastecherie.com and use code Endocrine Matters for an exclusive discount.
It is a cultural change. I think in the workplace, in the hospital setting, in our training programs for new moms, physician new moms, it is a shift in culture that needs to take place, that we need to normalize breastfeeding, that this is something that happens, that this is part of the world. It's a normal thing. And just to give those new moms a little bit of support and flexibility. As a society, as we're changing into a more healthier, preventive society, we're focusing on preventive health. Part of that is breastfeeding. And I hope that is given the importance that it deserves.
I am absolutely thrilled to have Dr. Alia Hussain, a phenomenal pediatrician and an incredible human being, on the show today. Dr. Hussain is a direct care pediatrician, and I trust her with my own two precious children. Her kindness, thoroughness, and genuine love for her little patients, their parents, and her field shine through in everything she does. She is also a bold and unwavering advocate for breastfeeding when it's the right choice for both mom and baby, and I am here for it. Dr. Hussain goes above and beyond for her newborn patients by seeing them in the comfort and safety of their homes, where moms and babies can thrive. She provides invaluable support for breastfeeding and new motherhood during those delicate early days that are so vital for building a healthy breastfeeding relationship. As a mom who has experienced this journey firsthand, this conversation nearly brought me to tears. I vividly remember those early days of motherhood. The uncertainty, the fear, the preciousness, and the overwhelming sense of responsibility that comes with nourishing a tiny human entirely with your own body. We know that breastfeeding offers profound health benefits for both baby and mom, with long-term impacts on physical and emotional health that ripple through entire communities, and even the economy. Yet despite living in a world obsessed with longevity medicine, nutrition, and preventative health gadgets, we lag woefully behind in supporting this natural, free, and basic right that every mom and baby should have access to. The lack of support comes in many forms: cultural stigma around breastfeeding, inadequate maternity leave, and inflexible work environments for moms returning after giving birth. These challenges are especially acute in healthcare, where a primarily female workforce, including physicians, nurses, and other clinical staff, faces unique hurdles. A startling statistic reveals that 25% of women physicians leave practice or go part-time within 6 years of finishing training. This should alarm us all, especially given the physician shortage we're already grappling with. For many of these women, the decision isn't about a lack of love for their work or their patients. It's because they're forced to choose between their careers and their families, a choice no mother should have to make. I've been there myself. 6 years ago, as my little guy struggled to thrive due to my unrelenting work schedule, I was on the verge of stepping away from medicine. The only reason I'm still here is because I found an alternative practice model that allowed me to prioritize both my family and my career. For too long, society has framed women's decisions to leave the workforce as a personal weakness. But the truth is, this isn't a flaw in women, it's a flaw in our work environments, and it's fixable. Women have risen to every challenge. We've had babies, driven scientific advancements, improved patient outcomes, and contributed financially to our families, all while shouldering more than 80% of child-related responsibilities. And yet, too many women physicians find the demands of the profession incompatible with their growing families. If we don't fix this, there may come a day when there's no compassionate doctor to care for us when we're sick. In this episode, Dr. Hussain and I discuss how supportive maternity policies, including meaningful maternity leave and breastfeeding accommodations, can keep women, especially women physicians, thriving in the workforce. These are women who have trained hard, who are capable, and who bring immense value to their patients and their communities. It's time to stop asking women to choose between their careers and their families. This conversation was one I truly loved, and I hope you will too. If you're looking for links to anything we discussed, be sure to check out the show notes. Hi everyone, today I have Alia Hussain, who is the best pediatrician ever. I can say this from experience because I trust her to take care of my two littles, and we are talking about something that is so important and under-discussed, and it is breastfeeding. And you might be wondering, why are we talking about breastfeeding on a health systems podcast? Well, what many people don't know is now most medical school graduates are women. 54% of medical school graduates are women. And in my field, endocrinology, 70% of endocrinology fellows are women. And pediatrics too. I don't know the statistic, but pediatrics is female dominated as well. And so this is a very important piece of the puzzle for supporting and keeping women doctors in the clinical space, as well as a way that we can connect and support our patients going through a very fragile, important time of their life. And so here Alia is. She's not only a pediatrician, but she's an expert in lactation and takes care of newborns. And I'm just thrilled to be having this conversation with her today. So Alia, welcome.
Thank you so much, Arti. Thank you so much for having me. And I look forward to discussing breastfeeding and motherhood and the challenges that come with all of that, especially for women in medicine, as they, they're in that age bracket as well when women are having babies during that time when they're training in residency. So it's a challenging time. I just wanted to introduce myself. I'm Alia Hussain, as Arti said. I'm a board-certified pediatrician. I've been in practice for 13, 14 years, so I've been doing this a while. I also have 3 kids of my own, and my eldest son, was born during my residency time. So I've been through it. I've been through the trenches with, all of the breastfeeding challenges that come along with, trying to, start breastfeeding during residency. And now I have a DPC, or a direct care practice, that basically has one component of it is that I do house calls for newborns in the first few months of their life. And so I get to see new moms, experienced moms in their homes, starting that breastfeeding journey the minute they get home from the hospital. And I work closely with a lot of lactation consultants to support them and to help them through that journey and to get that started.
This is such an incredible service, and I think any mom who has been in that space, unfortunately, I did not have Alia when I was breastfeeding my 2 kiddos, and my first one was born when I was a fellow too, and having a baby is hard and being a fellow is hard, and those 2 things, being a medical trainee, I should say, is hard, and having those 2 things at the same time certainly poses a special type of challenge. And I think that before you have a baby, you have no idea what you're getting yourself into. You have no idea what it's like to be another human sole source of nutrition, and the immense responsibility that comes with motherhood that we thankfully are naturally sort of gifted with when we have our babies. But first, Alia, I'm so grateful that you started by telling us a little bit about yourself. But tell me what drew you to your career and what has kind of gotten you to this particular space, because it is a very unique and special space.
My career started, just as a traditional pediatrician. I went through residency training and joined, a group practice where I was seeing, 30 to 40 patients a day, spending a few minutes, with each patient as most traditional insurance-based practices are. They are very busy, and you see your pediatrician in and out, in and out. Not a lot of time for new moms to ask questions. Definitely not enough time for the pediatrician to sit down and observe mom's, how she's breastfeeding, how she's holding the baby. Does the baby have a good latch? Is the baby getting enough? All of that. So I went through many years of, kind of doing the insurance-based traditional practices. And then during the pandemic, I started my own direct care DPC practice. And I wanted to offer something that was unique and that I felt there was a gap in what the pediatric care out there didn't have, which was the house calls for newborns. And so I do provide, within the first couple of months, I go out and, as soon as they're home from discharge from the hospital or birthing center, I go out and see baby and mom, and I spend at least an hour in their home watching mom feed. We do a pre and post feeding weight to see how much baby has transferred, looking at latch, teaching about different positions, different things and tricks that can work. And so I felt that there definitely was a gap in what moms were getting from their pediatricians in terms of breastfeeding and lactation education. And education for lactation and breastfeeding starts in the hospital, right? Like when you have a baby, usually new moms will get lactation consultant to come in and kind of educate them a little bit, 15, 20 minutes here and there. But then that's it. And then you go home and you're kind of like, okay, now I have this baby and I don't know what to do. And it's stressful and it's scary. And so that's kind of where I come in, and I, my patients can text or call me if they have questions, and they, especially new parents do have a lot of questions, which is great. But I prefer them to call and reach out to me if there's anything. And so I work closely with a good group of lactation consultants as well. And I also help moms kind of, start with that education and just teaching them hand-holding a lot in those beginning few months.
I think this is a beautiful example of recognizing what we can do as physicians and humans in supporting other people to better health and better experiences, and recognizing that in the system that is prescribed to us with the traditional insurance system, like we cannot give our best in that setting. And I love how you kind of took the reins and said, look, I can do better, but I'm not able to in this system that doesn't support me to be the best physician that I can be. So let me try something different. And Alia, can you tell us, like, what kind of things were you seeing in that traditional setup where patients aren't getting that support in the beginning? What kind of outcomes or problems were you seeing?
So just to give you a little statistic, about maybe 80 to 90% of moms start off breastfeeding their kids and their infants in the hospital. But maybe the statistics show anywhere from 20 to 25% of moms actually continue to breastfeed in the first 6 months. So where, that big gap, a lot of moms kind of quit in the first couple of days, weeks, months, because there are so many hurdles and so many struggles that come with breastfeeding. And it's not easy. Breastfeeding is a hard full-time job for mom initially. It doesn't come naturally for everybody. It is supposed to be a natural process. We think, all moms should breastfeed, all babies should be able to be born learning, they should already know how to latch, but that's not the case. There are a lot of babies that have struggled with tone issues. They have, latch issues. Obviously, anatomically, if a baby has any sort of palate or, sometimes rarely tongue ties or other, sort of structural problems. Moms can have inverted nipples. They can have low production. Stress can play a big role in it. So if, there's not a lot of support for mom where she isn't being sort of properly taken care of, and if she doesn't have a good support system in place, of course, that stress can play a role in milk production, and breastfeeding can then sort of be not as fruitful and can become a source of sort of stress and anxiety for mom as well. So, like I said, the traditional office setup for a pediatrician is back-to-back appointments. A lot of the education is done by the medical assistants or the nursing staff. So the doctor doesn't really spend a whole lot of time, sitting with mom and talking about breastfeeding in the traditional office. So the way my practice is set up, I have that luxury, and I really do. Even prenatally, we have a prenatal visit. Moms come in, they talk about certain things that they may have questions about, concerns about. We talk a little bit about what to expect. And then a lot of the breastfeeding support comes from actually sitting with baby and mom, helping her latch, showing her different techniques, getting a lactation consultant involved if we need to, and just a lot of education. I have some pictures that I show them, some little models and things to show them, just making sure that they have all those tools to help them have a supportive and fruitful breastfeeding journey.
Yes, I think that we assume that biologically we're supposed to do this, so it's going to be easy. And then you go through it and you're like, holy smokes, this is not easy. I actually thankfully was able to breastfeed both of mine for 12 months exclusively, but I don't think I would have gotten through it had my husband not been so involved. After I delivered my baby, or my older one, I was so tired. I was so out of it. I couldn't comprehend what they were telling me. And my husband really he kind of stepped up and really worked with them and took his own notes. And I tell people, my husband taught me how to breastfeed, but it's not always natural. It wasn't in my case, and we ended up having a successful relationship in that way, but it was hard and it's painful, and it really feels like you're doing it wrong in the beginning. And so I think that this type of support would enable many more mothers who want to breastfeed if they had this sort of I wish I had prenatal coaching, to help me understand what I should expect to come. But I think we've talked a lot about the challenges of breastfeeding, and I think it's important to go into why are we even doing this? Why is it important? Should we be so invested in this? And I think I know the answer, but I would love to hear kind of your thoughts on why breastfeeding is important.
So I kind of break it up into three pros, three lists of pros of breastfeeding. One, of course, is the obvious benefits to the baby. Nutritionally, breast milk is made by the mother's body for that baby particularly. And breast milk, the components of breast milk, the makeup of the breast milk changes, with the baby's age, with the time of day, with, obviously what mom consumes. And it's really, it's miraculous to me. I think I call it liquid gold because honestly, it's like food for baby that's actually specifically made for that specific baby, for that specific baby's age. And so there's numerous, benefits to breastfeeding. Obviously, the nutritional component, it is, full of, nutrients. It's full of antibodies, so it protects babies from infections. It's at the right temperature. You don't have to warm, if you're latching, you don't have to warm up a bottle. So there's obviously numerous health benefits to baby in terms of immunity and nutrition. And even research has shown that cognitive testing in babies who are breastfed versus formula fed, they actually, perform better on cognitive IQ testing and things like that. Not to say, formula fed babies, of course, they're getting the right nutrition as well. But there's a little bit extra sort of benefit to breastfed, babies and getting that breast milk. And then, of course, to mom, the benefits of there's a decreased risk of, I'm sure you've read this research as well, decrease in breast cancer, ovarian cancer, the bonding component, obviously the emotional attachment of latching. Not to say that formula-fed babies cannot have that bond as well, being held and bottle-fed. And then the financial component of it, right? You're not having to buy hundreds or thousands of dollars worth of formula for your baby when you have a natural source of food right there, like with mom. So those are probably the big ones. I don't know if there's anything else you want to add to that.
No, I think those were great. I think that there, in no way do we ever want to shame a mother who is unable to breastfeed her child or chooses not to for other reasons. I think there are plenty of ways to have healthy, happy babies, and breastfeeding is not the only solution for every single person. But I think there is strong data to show that if we are able to, this is the one thing that we can do for our children and ourselves that benefits all of us. And I think that we can't underestimate that knowledge. Like, if you are to tell people, pay thousands and thousands of dollars to have these screening tests, these early screening tests for cancers, and that don't have any outcomes, any positive outcomes linked to them, you know. But here we have this thing that's free that can decrease mom's risk of breast and ovarian cancer, which of course nobody wants to have, and can improve your baby's and child's lifelong health. And we're so health obsessed, you know, we're so focused on investing in our health, which is great, but some of the things are basic things like this that we can engage in so long as we have the right support. The sad part, though, is oftentimes we don't have the right support. So I would love to hear your thoughts on how, you know, particularly a lot of listeners of this podcast will be women in medicine. What particular challenges do you think mothers have when they are working moms or physician moms?
Being a physician mom, I think, comes with extra challenges. You know, as we all know, you know, our time is limited. We're busy. The kind of work that physicians do, you don't really have a lot of downtime, and the work is stressful, right? Your mind is engaged in ways, you have a lot of decision making. So, you know, I think being a physician and breastfeeding at the same time, obviously it comes with a lot of challenges, especially for those physician moms that are in training and don't really have a lot of control over their schedules, I think, and the situations that they're in. Of course, when you're in training, you're in the hospital, you might be in an ICU setting, you could be, you know, an emergency room, running codes, in surgeries for long periods of time. And when you're breastfeeding and you have to pump at work, obviously you have to do it in a specific amount of time so that your body doesn't kind of give that negative feedback that, hey, I don't need to produce this amount of milk. And that's where those supply issues come in with breastfeeding. So I think some of the challenges that come with, especially for physician moms, are, you know, finding that time, especially, you know, if you're in long rounds, or, you know, just taking those breaks every 2 to 3, 4 hours to go and pump, and then not having those safe spaces or private spaces to go and pump as well. That was a challenge for me during residency. I remember, of course, rounds were very long. And I was in a pediatric residency, so you can imagine, you know, we're very baby centered, and I was in the NICU where there were actual, you know, moms pumping and breastfeeding there. But still, even with that, you know, just finding that space, and the resident room was shared. There could be people knocking at the door and calling you or paging you for emergencies and things like that. So obviously those are challenging. And then especially for those moms who are in those medical fields that are procedural based, or if you're in the OR for long periods of time and you don't get those breaks. I've had physician friends who have done, you know, like wearable pumps where they've put the pumps on and, you know, gone into clinic. And again, not the greatest pumps in the sense that, yes, they exist, but they don't have the best suction. They sometimes, you know, they're okay. But that shouldn't be the case. Like, I think physician moms should have the ability and be given a little bit of, you know, that preference that, hey, it's time for me to go pump. I just need 15, 20 minutes. I'm going to go pump and I'll be back and I'll get back to work. And Obviously their productivity would probably be better at work, and just being able to, go and pump and come back and be able to take care of their patients. But definitely being a physician mom comes with its unique challenges: long hours, night calls, 24-hour calls when back in the day when those existed, when I was in training. Not the easiest being away from your baby for that long, and so I hope that with the future comes changes that are beneficial to physician moms, and we move in that direction, just recognizing that physician moms need that support and the tools to have a
and the grace, right? I think being given some grace or not, I think in medicine, even though more women are going into medicine than men now, it's still a male-dominated field. And I think a lot of women feel like we have to work like men, actually work harder than men to get the credit, equal credit, or at least some credit. And I think a lot of women, not just physicians, but women in high-powered fields or fields that require a lot of investment, like medicine, feel like they have to, do the same thing as men running backwards in high heels. And like with breastfeeding, it's almost like you are made to feel, or you just do feel intrinsically, that you are taking something away, and you should only be where you should only be giving yourself and your time. And I think that is something that is a whole mindset shift that I think we are working towards. But I do think it is a huge challenge. But you touched on something that I think is actually really important. And it's the one, pumping, but two, the importance of time spent with your baby. And I'm going to tell you a story that happened to me from a friend of mine that actually is a pediatrician. I think she was already done with her pediatric residency at that time. And we were talking about a trip, a bachelorette party too, actually. And my daughter was going to be about four months old at that time. And I was trying to figure out how I could bring her with me, because she was exclusively breastfeeding, and it's very difficult to exclusively pump for several days without your baby, because your breast milk production goes down. And this person was opposed to me doing that, and they were like, well, you could just pump. Everybody just pumps. And it was somebody who didn't have a baby. And of course I was pumping at work already, but it was also a pediatrician. And so to me, I was very hurt by it and upset. And clearly this person didn't understand what breastfeeding was, even though they were a pediatrician. So I'd love to kind of hear what your thoughts are on the real understanding of what this is like for moms. And at that point, I actually made a note in my head that I will never have a pediatrician for my children who's also not a mother, because I just didn't feel like they could understand, or at least a parent. But yeah, I would love to kind of hear your thoughts on that story, but more in the regards of like how are pediatricians trained around lactation, and is that helping or hurting us as a community in supporting our patients?
So going back to, when I trained, we were lucky enough where we did have some residency training with lactation consultants, following them and learning from them. There were some rotations that included some of that, which was great. I think that was my basic initially. This was prior to me. I think I did that rotation when I was pregnant with my first one. So it was helpful to me, as a physician, as a pediatrician, as well as, as a mom. So I learned a little bit from them. It was short, brief, very basic breastfeeding medicine, / lactation rotation, kind of rotation in residency. So a lot of pediatric residencies don't even have that. It's not, I think more breastfeeding medicine has been integrated over the last probably 5 to 10 years, which is great. I'm all for that. And then some pediatricians have gone on, and I have quite a few pediatrician friends who have gone on to get their IBCLC, which is they are certified lactation consultants as well. And then there's also certification in breastfeeding medicine that some people are doing. So there is more awareness around the formal education and what benefits that can have for their patients. And majority of these pediatricians are getting these trainings not, to increase their revenue or anything like that. It's really just for educating ourselves and educating our patients and having that knowledge that we can bring to them. So I think there is definitely a growing trend with, lactation. I do understand. I get, if you have a pediatrician that is not a parent, I think there are some great male pediatricians out there that are parents, that have seen, maybe their spouse's breastfeeding journey and have learned from that. But I do have some pediatrician friends that are not parents that are great pediatricians as well. So I think it just depends on the individual doctor, and I think how they feel as far as like supporting their parents and the moms who are breastfeeding, and what kind of education they have themselves and what interest they've taken in this specific. Have they sort of gotten a little bit more training in breastfeeding and how to help and ways to help their patients and moms. And some pediatricians really, they don't think it's their job. They're like, well, it's beyond my scope of knowledge, and, here's the number for a lactation consultant, and I hope you can find somebody that can help you. And that's fair. I mean, like I said, in some of these practices, you're seeing a lot of patients, you don't have time to sit down with each parent. But really, the thing with breastfeeding is if it's not established well, it's not successful for long, for that first year or whatnot. It's really those first few days and weeks that are so fragile and sensitive. And if there's too many challenges to breastfeeding, moms do, sort of give up, and then it doesn't continue. And the recommendation really is to breastfeed your baby for the first 12 months, and then AAP came out with a new one, I think, if I'm not mistaken, 2 years, which a lot of parents, a lot of moms don't breastfeed for 2 years. But, so it's really that initial phase where if parents are not, moms are not educated properly, they're not supported properly, then they quit. And unfortunately, finding the right doctor is very important, I think, especially for new moms who have never done it before, or moms who didn't breastfeed the first time around and have a second or third child, and they decide that, hey, maybe I want to give this a try, and maybe we can be successful this time around.
That's it for part 1 of this conversation. If you're enjoying the discussion, be sure to tune in for part 2, where we'll continue the conversation and go even deeper. Make sure you're subscribed so you don't miss it.